Hi, my name is Jennifer Aldana, nurse practitioner, student at Southeastern Louisiana University. This is for Nursing 683. It's the Clinical Practice Guidelines Evidence-Based Practice assignment. So at this point during the visit with the patient, we have already finished the history and physical. Excuse me. I've done an assessment of his cultural, environmental, lifestyle, and developmental issues. We've done the assessment of his learning style and also completed the health literacy assessment. The pretest by this point has been given and completed by the patient, and now I'm going to move forward with enacting the educational component of this assignment. So I'm going to refer to the patient. I'm just going to say Mr. Patient. Okay, so thank you, Mr. Patient, for answering all of my questions. Now we're going to go ahead and do the educational component, which is about diabetes management. So I've created a brief PowerPoint, which I'm going to show you as we move forward. But I also have a stack of printed patient educational materials. It's too much to go through here in this visit, but I just wanted to let you know that everything that we talk about in the PowerPoint, there is a corresponding sheet in here that you can refer to later on if you need to. Okay, so this is for you. So the first page is just the title page. It says diabetes management. I'll show the screen as well, or my cell phone. So this next page talks about lifestyle modification. In addition to medications, another way to help manage your diabetes is through lifestyle modifications. That would be things like diet, exercise. Both of those I have the next two slides are going to go over those in detail. Losing or maintaining weight. Excess weight results in insulin resistance and increases risk for other health issues like heart disease, non-alcoholic fatty liver disease, sleep apnea, osteoarthritis, reflux disease, and obstructive sleep apnea. So it's really important that if you're overweight that we want to lose weight to help prevent other complications. Your sleep is very important. You want to make sure that you get between 6 and 8 hours of sleep per night. If you're not getting enough sleep, the lack of sleep is associated with negative health outcomes. Basically, that can cause complications too and make you not feel good. If you smoke cigarettes, which you had already answered me earlier, you said you don't smoke cigarettes, you don't vape. You smoked cigars 25 years ago, but you no longer do that, so that is fantastic. We want to continue to not smoke. If you did smoke, though, that does increase your chance for cancer, cardiovascular disease, and things like stroke, pulmonary emboli. If you drink alcohol, again, earlier with our assessment, you said that you do not drink any alcohol at all. But if you do, you want to reduce that or stop it completely. With alcohol, that can increase your chance for liver disease and hyperlipidemia and many others. Anyways, that page was on lifestyle modifications. The next page is on diet. Again, everything that we talk about on here, this is a brief overview. Your sheets here go over great detail on all the different food groups and examples of all the different food. This is a great photo. This is from the American Diabetes Association. There's a QR code here if you want to use that. There's also a web address on here if you want to visit their site and get some more details. But this diagram here shows that half of every meal should be filled with half of every plate for every meal should be filled with non-starchy vegetables. Okay, and in here there's some example of non-starchy vegetables. So let's look at this list together. Let's look at all the non-starchy vegetables. Can you pick one that you do like? Okay, so that would be wonderful if you can start incorporating that into your daily meals. And then 1/4 of every plate should be filled with carbohydrates, and then the other 1/4 of your plate should be filled with lean protein ideas. Now, you had told me that a lot of your meals are ready to eat, and like frozen meals. Perhaps maybe with your neighbor, you could look over the list together, and maybe the two of y'all can go together and go shopping. And even if you just try once or twice a week, just to kind of get in the swing of preparing meals with fresh ingredients. And if you feel like you need further assistance with your diet, you can ask your doctor for a referral to a nutritionist. The next slide is about exercise. You had mentioned earlier that you used to do physical therapy because of the injury of your lower back. And you had expressed that you really enjoyed the physical therapy and it made you feel better. So if that's something that you would like to do again, ask your doctor if that's something that he can write a referral to, or if he can give you some advice on what exercises are appropriate for you to do safely. Once you've consulted with your doctor, these are some ideas such as walking, yoga, chair-based exercises, swimming, weight training. A goal to work up to for exercise is 150 minutes per week. You want 3 of those sessions per week to be aerobic and 2 of those sessions per week to be resistance training. Okay. And again, lots of details in here. I even have details in here about the different types of exercise and the benefits of exercise and the cons of having a sedentary lifestyle. This next page is about managing and preventing other health conditions. It's important to manage diabetes. Without managing it properly, it can cause further complications with your heart, with your eyes, your kidneys. It can cause neuropathy and problems with wound healing as well. It's important to control your blood pressure and your cholesterol. By controlling your blood pressure and cholesterol, you are reducing your chance of getting a heart attack or a stroke and reducing your chance of peripheral arterial disease. That's where the arteries in your legs don't work really well and you don't get that blood flow to your lower legs and feet like you should. Another complication that's common with people with diabetes is having problems with your eyes. So it's very important that you see your eye doctor at least once a year. And earlier you had mentioned that you do see your eye doctor twice a year, so that's fantastic. I want you to keep that up. That's to check for something called diabetic retinopathy. The retina is a light-sensitive tissue at the back of your eye, and that can become damaged as a result of uncontrolled diabetes. So things that you want to look out for is blurred vision, spots in your vision, and vision loss. If you experience any of these symptoms, you need to go see a doctor right away, call your physician, get some guidance on what you need to do, but you need to get checked out right away. If you untreated diabetic retinopathy can lead to blindness, so you want to take it seriously. And again, there's details about eye health as well in your packet here. Another complication as a result of untreated diabetes is problems with your issues. Problems with your kidney. It can lead to damaged vessels in your kidneys, which over time can lead to chronic kidney disease. Neuropathy, which you are familiar with as you do have neuropathy in your lower feet, that is a common complication of diabetes. And in the pretest that you took, you did answer that question correctly, and you know that it's important to check your feet every day for wounds. So you did get that question correct. So that's great. You already knew that. So make sure that you continue to do that. Check your feet every day for wounds, and if you see anything, make sure you clean it and treat it right away. And finally, make sure that make sure that you're up to date on all of your vaccines. Always check with your doctor first to make sure they're appropriate for you. But some vaccines that are important for those with diabetes would be your yearly flu, COVID boosters, hepatitis B. Well, you're older than 59, so anyways, pneumonia, shingles, and Tdap every 10 years. And the final page goes over other important components dealing with diabetes. On your pretest, you had answered this one, saying that your goal hemoglobin A1C needs to be less than 4. However, for those with diabetes, your goal is actually to be less than 6.5%. Right now, your hemoglobin A1C is 7.1. It used to be as high as like 10 and 11, so you've done a great job bringing that down. With some lifestyle modifications, I think you could bring it down even further to 6.5. So that would be your long-term goal. Do you monitor your blood glucose regularly? And when I did this with the patient, he did respond with he does not monitor his glucose regularly, so we had a conversation about the importance of that, and for him to talk to his provider about possibly doing a CGM, which he was willing to have that discussion with him. In the meantime, I encouraged him to pick up monitoring his blood glucose how he used to, but lately he hadn't been doing that. Medication compliance is really important. You do admit that you take all of your medications like clockwork, so that's phenomenal. And then you always want to be aware of hypoglycemia signs and symptoms. Are you aware of what to look out for, or do you have friends and family that know what to look out for? When I asked this to the patient at his visit, he said yes, he's very aware of what to look out for, things like dizziness, clamminess, feeling faint. And he said over the last many years, that's only happened to him once. He happened to be at a store when this happened. He was by himself. But so he sat down, and another woman approached him, and he explained to her that he had diabetes, and she went and grabbed him some candy, and then he felt better after that. I did ask him if he carries candy or juice or sugar pills on his person, and he said he didn't. So I encouraged him to read the little packet that I had given him, and to always carry at least 15 I believe it's grams. I'm forgetting. Yeah, 15 grams worth of snacks, drinks, candy, and glucagon with him at all times in a little fanny pack or whatever. And he stated understanding and that he will try to do that. And the last page is just quickly showing you where I got my resources from. Again, almost everything came from the American Diabetes Association and an article by the Endocrine Practice journal. All right, Mr. Patient, thank you so much for your time. Do you have any questions for me? Okay, again, thank you so much for letting me share this information with you. The last portion of this activity is having you do a post-test, which is right there. when he finished this post-test, he got everything correct, and on the pre-test, he got 3 problems wrong.